that of course we will wear masks because we are smart and because I care about you and because you care about me. Of course we will socially distance because staying away shows how close we actually are. Yes, we will set up testing and tracing and do whatever we need to do to mobilize to win this battle because we are America. We win wars, and we are the greatest country on the globe. And for all the pain and all the tears, our way worked, and it was beautiful.
It should be pretty obvious that you want to keep sick people away from places where there are a lot of elderly people, nursing homes specifically. In the state of New York, though, the governor, Andrew Cuomo, did the opposite. Nursing homes were required under the Cuomo administration to admit people infected with coronavirus.
This March 25th directive is cited by many for contributing to the more than 5,000 COVID-19 deaths at New York nursing homes, mandating nursing homes to take recovering COVID-19 patients while prohibiting the homes from.
Senator Patrick Gallivan of Lancaster noted a change in policy by the state health department.
They were allowing COVID-positive nursing home staff who are asymptomatic to continue working.
New York State is reporting more than 1,700 previously undisclosed deaths at nursing homes and adult care facilities.
Tragedy strikes at another nursing home here in the city. The Isabella Geriatric Center in Washington Heights says it believes 98 people died from coronavirus.
Well, a huge concern, of course, during the coronavirus outbreak are nursing homes and senior living communities. So what's being done to help slow the higher death rates in nursing homes here?
And Governor Cuomo has come under fire for the state's handling of the crisis at adult care facilities all over New York.
As Governor Cuomo's New York State barred people from visiting their loved ones in nursing homes, his state simultaneously forced infected patients into the same places. And now we hear of an extra 1,700 deaths at these homes. The death count nearly 5,000.
New York is a hotbed for COVID-19. Right now, senior care facilities are preparing for possible outbreaks. But what about when a nursing home resident leaves the hospital and goes back home to their nursing home?
Nursing homes are now considered to be ground zero in this battle against this pandemic.
Senior citizens, COVID-19, and nursing homes. The combination has led to deadly results. Almost 3,700 fatalities statewide.
There's a major scandal going on with Governor Andrew Cuomo's deadly decision to pack nursing homes with COVID patients. Instead of asking his brother about the disastrous mishandling, CNN's Chris Cuomo decided he'd rather joke around instead.
Now to the ongoing tragedy at New York's nursing homes. Critics are demanding accountability, and they say so far Governor Cuomo's response is coming up short.
This is the normal swab. Is it true that this was the swab that the nurse was actually using on you?
Statewide, there have been nearly 2,500 deaths in nursing home and adult care facilities. An employee who does not want to be identified at the Crown Heights Center for Nursing and Rehabilitation gave us this video from last week. Nurses begging for COVID testing after seeing 22 deaths in 7 days.
New York nursing homes have really taken the hardest hit from this pandemic. Many people have called them ground zero.
Jose Gutierrez was 88 when he passed away on April 19th. He'd been at Brooklyn's Cobble Hill Health Center since late January. Diabetic, blind in one eye, unable to take care of himself at home. He lost his life like so many other Americans not long after nursing homes stopped all non-essential visits, including by relatives, as overwhelmed facilities tried to keep the virus out and admittedly struggled to keep families informed about how their frail and vulnerable relatives were doing.
Well, as we've shown you, nursing homes are becoming coronavirus hotspots. And for the families on the outside of those facilities, the anxiety and fear of what might be happening to their loved ones inside can just be overwhelming.
We was trying to inquire about his health, and, they was giving us the runaround.
Joey Gutierrez and wife Ellie said they only learned of his father's death when they called the nursing home worried. Just days after state records showed Cobble Hill Health Center, at the time, had the most reported presumed deaths due to COVID-19 of any nursing home in New York State.
Makers are calling for an independent probe of COVID-19 deaths in nursing homes across the state. Erie County now has 400 deaths from COVID-19. And last week, officials said 55% of the county's total death count came from nursing homes.
Statewide, of all coronavirus deaths, 20% have been nursing home residents. But in the 8 counties of western New York, it's almost double, at 37%. Why would that be?
According to the governor's office, there have been more than 4,800 COVID-19 deaths in the state's nursing homes since March 1st.
Emails nursing home officials sent to New York State health officials from late March to mid-April asking for help, saying that they were in dire need of PPE, especially gowns and face masks, that over 50 COVID symptomatic patients were there, and we don't have the ability to cohort, meaning separate them based on staffing.
The number of bodies became so overwhelming, the home ordered a refrigerator truck to store them. Nursing homes around the city have been hit hard since the outbreak began.
And on April 9th, a request to send sick patients to emergency hospitals like the Navy ship USNS Comfort and the Javits Convention Center, a request that was turned down.
A truck acts as a temporary morgue outside New Jewish Nursing Home on West 106th Street in Manhattan. The lawyer for the King David Rehab Center in Gravesend says similar morgue arrangements are being made after COVID-19 patients were transferred there last month.
The state health department says coronavirus has been reported at 239 nursing homes, including 6 facilities where 40 or more people have died.
Deaths at nursing homes across New York State have been spiking. Some families say it feels like their loved ones are prisoners inside with no way of contacting them.
A rep for the mayor told me this is a state issue, so when I reached out to the governor's office, I did not get a direct answer.
Americans' eyes have been opened, and we have seen in this crisis the truth that government matters and leadership matters. And it determines whether we thrive and grow or whether we live or die.
Gutierrez had not been able to see his father for a month because of the mid-March federal mandate banning non-essential visits to nursing homes.
How do you feel now that you weren't able to be there with him at the end?
Horrible. Horrible. You feel like you fail your parent, you know? I never wanted to feel that way, ever. You know, it's a tough thing because I have to sleep at night thinking about this thing. Did I fail my father? I think people don't understand that.
Americans learned a critical lesson: how vulnerable we are when we are divided, and how many lives can be lost when our government is incompetent.